This client is about to receive administration of botulinum toxin type A on the 3 areas, which is the glabellar region, which is made up of the procerus and the glabella. As you can see, the client is frowning and you can see the belly of the muscle, and that's where we put our first injection point. That's where we mark it out. Then we go either side, which is approximately just under a centimetre away from the first injection point in the middle, and then we move either side. So those injection points are above the eyebrow, but they are avoiding the corrugators. The corrugators are a danger zone. Now what we've asked the client to do is to look surprised and to raise their eyebrows, because again you can see the belly of the muscles. So those injection point markers need to be placed right in the belly of the muscle. It is absolutely pointless injecting into the lines because it will have little effect, but there's also very little skin there. What we're doing here is we are making a line which indicates where the client's pupil is. It is a possibility that tox can spread up to a centimetre, it can disperse up to a centimetre. So if we were to administer tox and it was to disperse 1 centimetre, and it could make its way down through a vein in the eye line, which is why we mark up that line. What we're now doing is marking out any visible vessels that we can see. And you can see we've already as well drawn out the corrugators. We do not want to inject into the corrugators. This particular injection pattern is specifically designed so that we can avoid injecting into the lower part of the frontalis. Injecting in the lower part of the frontalis can cause an eyelid droop, or it can cause heaviness around the eyelid. So if we bear in mind the injection points around the glabellar region will push to either side. So by relaxing those muscles, what will happen is the client's eyebrows, we should see a visible stretch to either side. So again, if we ask the client to do a cheesy smile, you can see the visible marks around the Orbicularis Oculi. So as we know, the Orbicularis Oculi muscle is a round muscle split into 4 parts, and we want to inject into the belly of the muscle, and we follow the circle. If you can see here, what we're doing is we're following it around. So we are using, on this occasion, Botox. So we're using the product Botox. So we're administering 10 insulin units into these injection points here. So as you can see, the skin is being squeezed. What this does is this offers some sort of support to the client. And it temporarily and very, very slightly numbs the area. So as you can see, 10 insulin units are injected here. It's always wise to wipe the marks as you go along. So as you can see in that particular syringe, there are only 5 units left. So those 5 units will be administered into the frontalis, because those units, the frontalis, we only inject 5 insulin units of Botox. I will explain at the end of the video how that is made up of Botox units. So this is the last of the glabellar region, so that's 10 units injected there. Under the eyebrow we will be administering 5 insulin units. And again, wiping those marks as we go along. If we get distracted or if anything was to take away our attention from the treatment, we would be very confident that we had already injected. What we don't want to do is inject into the same area. As you can see, we're injecting away from the eye line. It's very important that we don't inject towards the eye. There are various reasons, but one, if something was to startle us, we could cause significant damage. Plus we're injecting in the correct direction into the Orbicularis Oculi. As you can see, we've asked the client to move their face so that you can be in the correct position. You can either move yourself or you can move the client. So again, as you can see, we are injecting directly. We're not injecting at an angle, we're going straight in. There's a little bit less skin around the temporalis. We've already checked for any visible vessels. And they are also 5 insulin units. If there is a tiny bit of swelling or blood, what we need to do first of all is to compress. We could see there that the client didn't find that discomfortable, or uncomfortable rather. So just simply applying pressure with a gauze is sufficient. So if we look at the angle of where the syringe is being placed, we are being very careful that we're not placing the needle to the right or to the left. This is going directly in front, and we are tilting the syringe at approximately a 45-degree angle. Always wipe away any of the white marks. We don't want the client leaving with any white pencil all over them. And here we are with the last few injection points on the frontalis. Five units. The eyebrow can be quite pinchy, so it's definitely good etiquette to hold the skin. I do check possibly two or three times during a administration of toxin. In this particular case it is Botox. I always check that the client is okay, they're feeling okay. Again, there's a mixture there of, as a practitioner, I needed to move my body positioning, but also I asked the client if they could move their skin. So there we have a complete administration of the main 3 areas. This is one injection pattern that I use on a regular basis now. You will see other videos that will show different injection patterns.